We have already discussed about the life cycle of the Taenia solium as well as the Taenia saginata. Same time, you have also discussed the what is the Taeniasis and what is the cysticercosis, and already the brief morphology of the parasite, both the parasite Taenia solium as well as the Taenia saginata. So I'll discuss little bit about the Taeniasis as well as the cysticercosis. So here is we'll see one by one the clinical sign or manifestation caused by the tinea species. One situation or condition is known as a tenacious. Tenacious means tenacious in this condition will see the human act as a definitive host. In the both the cases, which is arises due to the tinea solium as well as the tinea saginata. In this case, the human act as a definitive host, and the adult form resides inside the small intestine of the human being. So, and they continue excrete the proglottids, gravid proglottids or eggs through the feces, and through the feces either infect the premises or through the vegetation or due to the caprophagous nature of the intermediate host like pig, the intermediate host can get the infection of the tinea solium. So this is the simple life cycle where the human act as a definitive host, and two intermediate hosts is there, pigs and the bovine or cattle, the, for the tinea solium as well as the tinea saginata respectively. So this is the normal condition which is known as the tenacious. And another one is the cysticercosis condition. So in cysticercosis, as we all know, the human act as a definitive host in the both the species of Tinea solium and Tinea saginata. But in this time, human also sometime also act as a intermediate host. Means it may be due to the auto-infection from the inside if the egg ruptures, and due to the reverse peristalsis movement. Again, they consume the egg of this parasite, or due to the unhygienic hand practices, again through the fecal-oral route, human can get the infection of the eggs of the cysticercosis. Uh, this is Taenia solium, specifically why Taenia solium? Because already we have discussed about the chances of the the excretion of the or separation of the proglottids or eggs is somewhat passive in case of Taenia solium as compared to Taenia saginata. So in that case, what happens sometimes eggs which is ruptured inside the body or means in anal region of the human being in case of Taenia solium. So the chances of the cysticercosis or condition which is arises is more common, prone in case of Taenia solium, not in case of Taenia saginata. So in that case, anyhow, human being can get the infection or get infected by the eggs of the parasite, and human act as an intermediate host in this case. As we know, the intermediate host, when egg ingested by the intermediate host, it enters into the intestine and ruptures, and then it moves in either in the muscles of the most common muscles of chest, tongue, neck, or in the intermediate host. Similarly, in human also, in this case, it moves into different muscles like superficial muscle or subcutaneous layer, and then it forms the larvae stage. That is known as the cysticercosis. Means this condition is known as the cysticercosis, and larvae is known as the Cysticercus bovis or Cysticercus cellulose in different species of the tinea. So, okay, then there is some chances, some 25% of the chances that this larvae can move into the eyes. So it may lead to the ocular cysticercosis. In sometimes, which is very dangerous form, which is known as the neurocysticercosis, and in this case, the larvae of the Taeniasis may move on the brain and it causes the neurocysticercosis. So these are the Taeniasis and cysticercosis condition. So generally, when the human act as a definitive host, uh, generally that is termed as a Taeniasis. But in case where human act as an intermediate host, that condition is known as a cysticercosis. So we'll discuss one by one about the Taeniasis, what is the clinical manifestation in human in case of Taeniasis as well as in cysticercosis. So here you see in clinical side in case of animals, you normally the oncosphere or the larvae can move into the muscles, either in skeletal muscles or cardiac muscles, and some visceral organs. So accordingly, it will show some mild symptoms. Not that symptom was too much prevalent in case of intermediate host in animals. So it will show the mild symptom of increased pulse rate, respiration rate, slight increase in the body temperature, and it is also depends on the how much larvae is there in the muscles. So number of or dose of infection is also very important. Accordingly, it will show the symptoms. Okay, it will shows local inflammatory reaction at the localization site, and sometimes it when it is in the cardiac muscle, or it will lead to myocarditis and sometimes heart failure, but it also depends on the number of infestations. Okay, in case of human being, if the condition is Taeniasis, means the adult worm is resides inside the small intestine of the human being. So it will definitely it will show some genetic gastrointestinal GI disorders like nausea, abdominal discomfort, gastric pain, diarrhea, vitamin deficiency, because the adult parasite will consume the blood or nutrition, not blood, actually nutrition. It will consume the nutrition, not blood, because it is not blood sucking parasite. It will consume the nutrition, so it will lead to the vitamin deficiency. It will lead to the increase in appetite or sometimes loss of the appetite also. Then, because it consumes the nutrition, it will lead to weakness, weight loss, digestive disturbance, and sometimes intestinal blockage, because already we know the parasite is very long, tape-like structure. So sometimes it will lead to the blockage of the intestine also. So these are the some symptoms of clinical sign you will observe in case of Taeniasis infestation in human being. Okay. Next is the porcine cysticercosis. And what are the symptoms you observe in the swine? Normally, similarly, it localized that larvae is present in the muscles or subcutaneous fat in the pigs. Here you can see in the picture small white color water-filled rice uh, appearance, not rice exactly, this is water filled structures, somewhat pale in color is you can observe here in the muscles. So these are the circus cellulose. Okay, so during the post-mortem examination in the muscles, you can observe small filled structures, and this also rarely associated with the structure. Means if the swine is already infected or infested with the cyst, but it will not show symptoms. But whenever it is the condition of the neurocysticercosis and swine, then it will show some signs like the excessive salivation, or blinking, and the tearing. So these are the some symptoms you can observe in the pigs during the infestation of the Taeniasis, infection with the Taeniasis larvae. Then in human, already we discussed how human can get the infection or infected by the eggs. First one, by the hetero infection eggs, which is present in the contaminated food. And it may be one of the reason. And second reason, hetero infection means if the someone other is infected with the adult parasite, and from there you can consume the egg of the parasite. That is the heteroinfection. But sometimes it may be autoinfection. Autoinfection means it may be due to the exogenous or endogenous route. First one is autoinfection. It may be due to the anal oral contamination and due to the unhygienic practices of the hand of yourself, of the infected person. And second may be the endogenous autoinfection. That is the maybe one of the reasons is reverse peristalsis movement. Already we discussed if the adult parasite is present in the intestine and during the procedure of the separation of the proglottids, the egg ruptures, and due to the reverse peristalsis movement, again you can get infected by the eggs of the parasite. So these are the some chances. In that way, you can that develop the condition of the cysticercosis. So these are the some condition, and similarly here the human act as an intermediate host. In this case, the larvae develop in the tissues or muscles, skeletal muscles, or the muscles of the diaphragm, heart, peritoneum, pleura, or subcutaneous tissues. So these are the localization site of the parasite, and very rare case already we discussed. Sometime it move into the eyes and subretinal layer of the eyes, and sometimes it moves to the brain also. So these are the some condition where the it will shows the different type of the cysticercosis in human being. So first one is a muscular or subcutaneous cysticercosis. Means the most common type is the that is muscular cysticercosis in case of human being. So it is prevalent. It is less prevalent, but in India it is highly prevalent. 10 represent about 10% of the cases. And in muscles, if it is localized in muscles, it mainly localized in muscles of head, limbs, neck, and abdomen and back muscles. And because of the localization, it causes the pain in that particular muscle because it anyhow it will press the nerves and it occupies the space. So it causes the pain in the muscles, related muscles. It will lead to the hypertrophy, and sometimes there is a life of that larvae which is present in the muscles or somewhere in the tissues in the intermediate host. It may survive up to 9 months. After that, it becomes calcified, and that's just larvae become dead, and later on it becomes calcified. So there, similarly here also, you after some time you will observe the dead and calcified larvae or cysts present in the muscles. So this is the muscular cysticercosis. Okay. Then second one is the ocular cysticercosis. Ocular cysticercosis means it move into the larvae move into the muscle into the retina in subretinal layer or eyes. So here also it will leads to the some visual disturbance or double vision or some protrusion on the retinal layer of the eye. Definitely, it will lead to the some visual disturbance because worm or particle is present in eye. It will lead to the inflammation. Because of the inflammation, it may cause the blindness also. So these are some symptoms we observe during the ocular cysticercosis infestation. So this is the ocular cysticercosis, and this is not very prevalent. It is a rare type of cysticercosis, and it is about 2.5% of the overall cysticercosis cases. And third one is the neurocysticercosis. In neurocysticercosis, when larvae move into the brain, then it will shows some neural signs like initially you'll observe the headache, nausea, vomiting, blurred vision, some neurological change like confusion, and it will lead to the intracranial pressure. Then obviously it will lead to the inflammation in that place and degeneration of the tissues, muscles there, muscles, tissues there. So it may lead to the epilepsy. And noted that in 70% of the neurocysticercosis cases, it will lead to the epilepsy. So these are the some symptoms of the neurocystic psychosis, and this is very dangerous type. You can say in all the type of the cystic psychosis. So initially, there are four stages you can say. Maybe first it will form the cystic type, means normally fresh fluid filled structure will observe. Later on it will become degenerating and it will lead to the colloidal or granular stage, that cyst. And later on it become dead and calcified. Later on it will lead to a nodular stage, fibrosed, and later on last stage is calcification. So you can see the different stages of the neurocystic psychosis. These stages are also present. You cannot exactly categorize uh, in all the larval stage which is present in the intermediate host in different categories. But ultimately, after some time, it becomes calcified, dead, and larva becomes dead, and later on it becomes calcified. This is similar, same for all the larvae which is present in the intermediate host. So here also different stages are present of the neurocystic psychosis. So you can categorize the neurocystic psychosis in four forms. Okay, so this is all the four forms of the neurocystic psychosis and three types of the cystic psychosis: muscular cystic psychosis, ocular cystic psychosis, and neurocystic psychosis in case of human being. So how you can diagnose the disease? How it is very easy diagnosis or identification by the examination of the fecal smear or examination of the egg. So there are various technique like brine flotation technique, cellophane tape technique, or scotch tape technique. These are the some adhesive tapes we can formally you can touch to the perianal area, and one solution, staining solution, you can touch the tape on the slide and you can observe directly the eggs, if any eggs are present. So these are some techniques of the examination of the eggs or prolactin in the stool samples. So there are some fecal concentration technique is also there. Then you can also observe the tinea antigen in the stool samples. Now, cysticercosis you can observe by the clinical manifestation, as well as you can go for the neuroimaging or radiological imaging like CT scan or MRI. You can go for the electro-immunotransfer blood. This is also a antigen antibody test, means this is the serological test. Other serological tests are ELISA. It may be of antigen detection ELISA or antibody detection ELISA. And you can also test this by the dot ELISA. So these are the some tests. Similarly, other tests are means common like serological test or imaging, but here you can also go for the carcass inspection, and you can observe the cyst which is present in the muscles, skeletal muscles, heart, masseter muscles, sternus, triceps brachii, or diaphragm. So you can search the cyst of the tinea saginata in case of cattle, or tinea solium in case of pig muscles. So these are the some diagnosis for the cattle. Similarly, in pigs also, again you have to inspect the carcasses, and cysticerci, which is present in some pinkish or red color, you will observe as meat means. This is very difficult to diagnose the cyst in the muscles of pig. So carefully we have to diagnose the cyst which is present in the muscles. Different muscles, it is site or location is same, just like in cattle. The tongue, diaphragm, skeletal muscles, you can observe the cyst. So one technique is there, tongue palpation of the tongue. It will you can observe the cyst which is present in the tongue, and you can also see the protrusion at the tongue. Means this is a visual inspection. So it may give 100% specificity. Specificity means you can observe uh, means if the you can observe the uh, cyst on the palpation or somewhat visual inspection, there may be chances, 100% chances that pig is infected with the Taeniasis infestation. So these are some technique or detection method for the diagnosis of the cysticercosis in the pigs. Okay. These are the other serological tests similar for you can use for as in human being as well as in cattle. So ELISA or immuno transfer blood techniques is there for the detection. So any question for him? No treatment. Some herbal treatments are found effective against the Taeniasis, exopompines, sheep, or aracatatus. I don't know about the actual rate or proportion we can give the animal for the treatment of the Taeniasis. So there are some drugs are there, praziquantel, glucosamide. So there are some doses are there like 5 to 10 mg per kg body weight in case of adult, or here also similar dose rate is there for the young ones. So you can give this drug, or these are the drug of choice for the Taeniasis. Here also we have to main concern about the neurocysticercosis if the person is infected with the nervous, shows the nervous sign or infected with the neurocysticercosis, then you can go for the surgical or cyst excision. We have to remove, and we can give the steroid to decrease the inflammation, and also you can give the drug of choice like praziquantel or albendazole. So these are the some treatment for the cysticercosis and as well as the in case of Taeniasis. So prevention and control measures, already we know how the disease is transmitted, how mainly the main route is the improperly cooked meat, either beef or pork, may be the most important or main source for the infestation in case of human being. So the careful examination of the carcass, education of the people is generally the most of the people who is working in the slaughterhouses, we need to educate them, okay? Because they are involved in the processing of the meat and examination center. However, some it requires some professionals like veterinarians during the examination of the meat. So anyhow, we have to educate the people about the disease transmission and the proper cooking of the meat. It's also very important. The cysts are present itself, but if you are using proper cooking or hygienic method during the cooking or processing of the food, so we can avoid such conditions. Then you can see the hygiene during proper hygiene or serious disposal is also very important, because egg is excreted in the human feces or excreta. So proper disposal is very important. If already if you use toilets at home in the like just like in developed countries, the chances of the spread of the eggs in the atmosphere or in the water or in the vegetation will be less. So this is a very important, and hand hygiene practices or education of the people about the transmission is also very important. So you can also process the meat or products, like if you are storing the meat at minus 20 degrees Celsius or lower temperature up to 2 days, or if you are making the pickles of the meat in the 25% bran solution or salt solution, in that case also it will rupture or it will kill the cyst. And obviously the cooking at the 57 degrees Celsius for sufficient time is very important for the disruption of the deactivate or kill the cyst. So these are the some measures you can take. Already discussed the adequate meat inspection is very important. Then proper chemotherapy, or this is not a part of but you can go for the mass chemotherapy as a prophylaxis. So this is the prophylaxis as a prophylactic agent. You can use the drug. This is the preventive measures, and then you can also vaccinate the intermediate host, mainly pigs, and some vaccines are also available. This is not frequently used, but in routine vaccination, but it is available, and this is the recombinant vaccines. Which is, maybe it is used in the developed countries, not very practiced in Indian continents or South Asian continents. So these are some preventive control measures point for the control or prevention of the cysticercosis or taeniasis. So this is all about the clinical sign and diagnosis.